Good morning. Thank you for being here. I'm Bernice Pescasolido, and I'm faculty on the Bloomington campus here at Indiana University. And I'm happy to be talking to you about your family members, those are people that you loved. I'm sorry for the circumstance that we're here, but I want you to know how important it is that you're sharing your stories with us. So one of the ways we'd like to get started is just by knowing a little bit about those people that you loved in terms of the kinds of people that they were, why you love them, and how you feel about the loss.
Sure. So my son is Brandon, and he was 23 when he passed. Wonderful young man, very active, very social, smiled at everybody no matter what he was dealing with in life. Enjoyed baseball, coaching his little brothers in baseball, dirt bike riding, jet skiing, was in the marching band, and just loved being around people and making people laugh, and loved putting smiles on people's faces.
My name is Jennifer Burton, and
I'm Chris Burton.
And our son, Zach, was 27 years old when he passed away of an overdose on September the 2nd of 2017.
We have three sons. Zach was our middle son, and like Jenny said, he was 27 when this happened. But when Kirsten, when you were describing your son, it sounds a lot like our Zach, quite frankly. You know, he was just a great young man and had so many friends, and he always wanted to help people and active, and you know, he played football at Bishop's Retard High School, was a two-time football state champion, really good athlete, snowboarding, wakeboarding, anything outside, Zach loved to do. And he had so many friends, and so it's just, and we have a really close family, like I'm sure everybody else is here. And so Zach was special, to say the least.
It's one of the reasons why it's so hard to comprehend these losses, because the people that we hear about are just so wonderful and just such a good part of their family, and it's very hard to understand why this happens. So Jill, can you tell us a little bit about your brother?
My brother's name was Guy. He was a gentle giant, just a big 6'2", 6'3", big old redhead with this incredible arm span. It was just, our family's a very short family, and the fact that he was so large was hilarious. But he was a very quiet person. He would kind of, until he got to know you, be very reserved, but once he did, he would talk your ear off. He had a very funny, somewhat occasionally inappropriate sense of humor, but if you knew him, it was you'd be on the floor laughing. He was fiercely loyal over the people in his circle. Just a really good kid, you know.
It's part of the mystery of all of this, and trying to face the challenge, is that it's not one type of person, right? They all turn out to be people that you loved and people that were contributing to society, but they were very different. I love your image of the sort of ginger, gentle giant.
Yeah.
So, and then it's not just our brothers and our sons, but also our parents. So can you tell us about your mom?
Yeah, my mother's name is Eileen. And she's a mother of 6, and she was a very kind, warm-hearted person. She made everyone feel comfortable. She was the person who not necessarily made everyone laugh, but she was the one always laughing. You know, very loud, very boisterous, but always made everyone feel at home, and that's who my mom was.
That's terrific. And last but not least, we have
Yes.
Matt. And Matt, can you tell us about your Jasmine?
Yeah, so my girlfriend, her name is Jasmine, and she was a beautiful person when you see photos and you see her, but I always say if you knew her, she was even more of a beautiful person just on the inside, and I think that's why I fell for her. She just had like a bright smile, lit up a room. On that, you know, her laugh, I hear it in my head all the time, and she was very much for her family and friends. She would do anything for those people, and just her pure kindness for others. She was just a very, very sweet person, and she taught me a lot about the correct and right way to treat people.
Yeah. One of the things that really helps us as scientists in trying to face this challenge is really hearing your stories. And one of the things that I think would be really useful for us to know would be about, did you notice something was wrong? When did you notice something was wrong? What were the kind of signs, or were there signs that, made you start to have concern?
I think for me, Brandon, he was not living at home any longer. He was 22 when I found out. And so I didn't really see a lot of signs. But when he would come over for dinner, there were a couple things that I noticed. He would fall asleep and out cold hard, just in the middle of the living room. And to me, that didn't raise any red flags, because I had no idea what I should have been looking for. I just thought, well, he's worked a 12-hour day today. He just must be really tired. And so I didn't know anything. I had no clue until he actually came to me and told me that he was struggling with addiction and what he had been going through. And I just was completely dumbfounded, and just, you go through that. How is this happening to my family? How is this happening to my child? Because it's not anything that you as a parent ever think that you will be dealing with or going through. I mean, this is the little boy that you saw flourish through life. And, for them to come to tell you that, it's heartbreaking. And for them to tell you that, Mom, this is literally the devil, and to see that despair in their face and in their eyes when they come to you was really, really hard.
So what about Zach?
Well, Zach was a sophomore in college, and he, like so many others, in high school, he, drank some, and, like the typical high school kids do. And so he was doing really well in school. He had to work hard for his grades, and he had a B average, so that was great. We didn't really see any signs just because he was not living at home. We have a really open family, and we talk a lot. A lot of people think it's funny because most boys tend to be closed mouth and don't talk so much, but our boys, they told me a lot, and oftentimes more than I even wanted to know. But Zach called us, and he told us that he was having a problem, that he had taken Oxycontin, and that it had really grabbed a hold of him. And he said that when he took the pill, that he felt more euphoria than he had felt ever in his life. So that's where it all started, and then that's when our journey began of trying to figure out what to do.
And for someone who was so industrious and worked for his grades, you can see why that feeling was something that, was a relief for him in many ways. Because I think this, the images that I think the public has in their head of who people are who die from overdoses really doesn't match the reality, and certainly not the stories that you're telling.
Addiction's not a stranger in our family. Unfortunately, my father is also the sibling of someone that passed away from addiction. My aunt passed away a month after Guy passed. And I was 17, he was 15, and he had gotten a staph infection actually on a vacation. And when we caught that, took him to the hospital, where he was introduced to morphine to help with the severe pain he was going through. And I don't know if the way I'm wording this is correct, but in our family, if access to that's left unchecked, it can cause a problem. And Guy got a taste of that, and he also dealt with mental health issues that I think that he used that to help alleviate what was going on with him mentally. And so there wasn't any, I want to say necessarily sign right away. We saw that, we recognized when he got that it was something had changed.
Right.
And
You were all vigilant about it as well. And
Uh-huh.
that didn't help. And
It was something that I think that he had used to try to help with what was going on with him mental health wise, just
Yeah.
for the duration of his life.
we see that really among men quite a bit. And we call that comorbidity. And the idea that you use substances to deal with mental health issues, because men are notorious about not wanting to appear weak or to go to a physician in general, never mind a psychiatrist. So,
As an adult, we would know he would relapse or fall back into it because we would notice he's not taking his mental health medication, and maybe his hygiene or home would start to deteriorate a bit more. And then he was doing well, home was clean, show up to work, he would be more alert, on time, just more present. And when he wasn't, that was normally a sign that he had strayed and started using again. And that was kind of how we noticed. He ended up using heroin, and he passed away from autopsy reports said a fentanyl overdose. But I know it started with morphine, and then from my understanding, would try to get his hands on other prescription medications, and then left the house, went to college briefly, and got his hands on heroin, and it just devolved from there.
one of the things that's really interesting about this epidemic and the losses that we're seeing is that the stigma is very different than it is with mental health problems or alcohol abuse. And it has very low what we call onset stigma, which is there is very little blame that the public puts on people who become addicted. Because unlike other situations, they see this very much as resulting from the kind of story that you're talking about. So a legitimate prescription that then for certain people who are vulnerable for whatever reasons, whether they're genetic, biological, social, psychological, then become addicted, and you can't really predict who that's going to be. So the onset stigma is actually very low compared to mental illness and compared to alcohol use. But the offset stigma, which is the rejection, the isolation, the discrimination, the prejudice, is just as high as it is for all those other problems. So we'll talk about that a little later on, but really want to finish hearing a little bit about more the pathways that you all saw. Okay, so tell us a little bit about the pathway that you experienced and saw with your mom.
Well, growing up, my mom, she did a very good job of hiding her addiction from me because I was a child. So my mother and my father were heroin users when I was growing up. So before I was born, my father started using. He went over to Vietnam. He was seeing all this crazy stuff, all that trauma. So he zoned out purposely by using heroin. So when he came back with an addiction. He met this wonderful woman who was my mother, and slowly introduced her to it. So growing up, I would see things, but I didn't know what was going on. At the age of 13, I was removed from the home. I was taken away from my parents. We got evicted. I lived with my brother from 13 to 21 years old. So during that time, I didn't see my mom or my dad much. And when I did, it was always, it was around money. Hello, son, how are you doing? I'm sorry I haven't been keeping up with you. Do you have some money to borrow? I can borrow, and I'm a teenager. So when I graduated from college, came back home, that's when I started seeing the signs. So my mom, she was one of those people, she would get hot very easily, right? So if it's in the summertime, she would walk around with long sleeves on. That's weird, right? You're a very just naturally hot person. She would always have on jeans. So one night, I remember seeing track marks in her legs, and I asked her, I said, "Ma, those look like track marks." And she covered her legs up and she began to scold me. You disrespected me. Those aren't drug marks. And I let her know. I said, I know that you're on drugs. Dad's in the penitentiary right now because of drug selling. So I know that you're on. I'll help you get off if you're honest with me. And but she refused. And I don't know if part of it obviously is stigma, just the shame, the guilt, and all of that, and being a parent, just not wanting to, show your child like you're this low. So that was the first actual sign that I knew that my mom was using?
So my story with Jasmine's a little different. I myself am in recovery, and I'll have 4.5 years sober next month. And I met her kind of through that process. She had gotten sober and in recovery, and that's when I met her. So the time we had together, I got to see, her grow and, just become even more of a light, and it was working again, just had her own place, and for me, from my experience with it, I thought things were going good. There's been a lot of times where I've thought back on it, could I have done something differently? Were there signs? And it happened 2 days after Valentine's Day, and we spent Valentine's Day together, had a dinner and everything like that, and it was just that one time I randomly stopped by her place because we had planned to meet later, and she wasn't answering her phone, and I had the keys, and so I just had a weird feeling, and I ended up going by her place, and I found her. And so in her case, I think it was just that one time. She went back to it, and that's all it took. And when she was in the hospital, they let us know there was fentanyl. She went back, used heroin, and they said it was laced with fentanyl. And just from the time I had spent with her, the months even leading up to that, she seemed happy. And but again, just being a person in recovery myself, sometimes I wonder what was really going through her head, because I know how that can be, where I could put on a smile and
Right.
act like things are going good when really maybe they're not internally. So that's the part that's really tough too. It's just, sometimes wondering what was really going on at the time.
Congratulations on your sobriety. And what kinds of supports do you rely on? Do you depend on? Did you find during your own journey?
Like before or after that situation, because me getting into recovery was not an easy road either.
Right.
I graduated from IU down here in Bloomington,
Yeah.
and I took stuff to the extremes, and I probably abused multiple substances, but I never thought it was to the point where it was a problem. And then I had an injury while I was a student here, and was prescribed pain medication, which rightfully so. I needed it, at least to sleep at first. I smashed my hand really bad, and they probably gave me a lot more than I needed. And for me, that was when it started. I never had a taste of that before. I didn't really like pain medication. It made me nauseous and things like that. And it was like a light switch flipped. It was just different that time. And I had friends have interventions on me, parents extremely supportive. And eventually I came clean to my parents because I just didn't know what else to do. And even then it was still a struggle. So the biggest support for me when I got into recovery was getting in the recovery community, being around other people who have gone through it themselves, people who understood it. My parents and family and friends are completely 100% supportive of what I do, but there are still times where I don't think they quite understand it, and that's why it's important for me to surround myself with people that do.
I think it is very hard for us to understand it. I think it's very hard to find support. Because I do the work that I do, even though I'm a scientist, I probably get one call a week from a parent or a friend of a parent asking me, where can their child go, who's down here? And I'm at a loss myself. So I'm very interested in knowing the supports that you did find and the challenges that you faced, because it sounds like there were struggles all the way along.
In terms of support for me in my recovery, I do 12-step recovery meetings and things like that, and I attend workshops, and I have a core group of people in my circle. But then when everything happened with Jasmine, just from suggestions from other people who have been through similar situations, it was actually a coworker of mine recommended a grief and trauma therapist, and I'm so glad I did that. It took me a couple months before I finally jumped on board with that, but I knew I had to do something. And thankfully I was already in recovery and had a lot of support around me, because if something like this would have happened before all that, it would have been bad. And I wasn't exactly sure how to deal with it or what to do. So again, when people suggested stuff, just kind of how I did in my personal recovery, I tried to follow through with that, and I ended up seeing a therapist for probably about 1.5 years. And it was a process. It was not easy, but it was extremely helpful.
There aren't any quick fixes. I think we know that. So what kinds of supports did you have, or were you challenged in finding things?
For me, it was a challenge. This was 6 years ago when my son Brandon came to me with the addiction. And there, of course, for me, there was a lot of stigma. I mean, I was probably kind of in that same boat, because 6 years ago, you didn't, at least for me and my family, I didn't hear a lot about heroin and addiction. And so I was kind of in that category until it touched my own family and my own child, thinking like, oh, wow, that's not going to happen to us. Or, it wasn't a thought even in my mind, because I didn't know anybody. I hadn't heard much about it. So it was a challenge for me, and I was felt like I was trying to tread water. I didn't tell my family, so I didn't really have a lot of support, because I was in shock, and I was scared, and I didn't know what to do, and I was afraid that people were going to judge him. So I kind of kept it a little isolated, I guess, and just tried to do what I could to find help and resources. We finally did land him in an outpatient. Surprisingly, and this was shocking for me, is they said he's not severe and his addiction is not severe enough to be admitted into an inpatient unit. And I just about lost it, because I'm like, somebody needs to protect him. I don't have that ability. I don't have that capability. I don't know what to do for this. This is what you specialize in. You need to help my child. And for them to say, well, we feel like he'll be best fit in an outpatient recovery program. And I just felt like, okay, well, this is the only choice we have, so we're going to have to do it. And even still now, I think for a lot of people, there aren't enough resources out there at all, and the right resources, because this isn't just any addiction. I feel like heroin, when you have an opioid, or heroin, whether it's pain medication or straight heroin, that's not something that you're going to be able to just stop. And, I just feel like the programs are failing our people, our loved ones. I'm going to kind of back up to the night before. My children had been with their father for the weekend and spent some time with him. I had moved my son back home once he came to me to tell me that he was suffering from the addiction. So I said, well, you need to come home so that I can help you. So he was living with me at the time. And he got home Sunday evening, and I could tell that he didn't seem quite right. Like there was something, like I felt like I think he's using again. I remember before I went to bed that night, and we were in the kitchen, and he said, "Mom, did you miss me?" And the last thing I said to him was, "I always miss my children when they're gone," and hugged him and kissed him goodnight. The next morning, I got up to go downstairs to make sure that he was up and getting ready to go to treatment. And I saw that the basement light was on, the door was open. And I thought, oh, wow, he's already up. This is great. So I went downstairs and I heard the TV. And I was like, oh, Brandon, are you awake? And by the time I got to the bottom of the stairs and looked to my left in the bathroom, he was lying on the floor. And he was so cold. And I knew that there was nothing I could do. It was too late.
And he was in treatment at the time. You're a medical professional. You clearly loved him, took care of him, and sometimes the pathway just... Does anybody else want to talk about that day? Bring us back to that day. I think that really helps other people understand this.
One thing I want to add, and Jenny can talk about the day, but I just, as far as the, the path to care, like we were talking previously, is difficult, finding the right place. Okay, so when we told you about Zach's story, he never had any issues in high school. I mean, nothing like this ever happened his first year at Ball State. He had a B average, and then his sophomore year is when his friend who he played football with in high school's father had back surgery, brought Oxycontin back to school. So him and 5 of the friends, they're college kids. They made a bad choice and tried it. And so what we've come to find out, we know a lot more about addiction than we ever thought we would know. If you have an addictive gene, it's a whole different ballgame. Yes. Okay, and so I wanted to make that's very important, I think, in our story with Zach, because he just never had any issues. And so he has an addictive gene, and his friend who brought the Oxycontin to school has the same addictive gene. So both of them became addicted. The other 3 could, as Jenny says, sometimes can dabble in it. It didn't affect them like it did Zach.
If I could just real quickly touch
Yes.
on the gene issue that Chris brought up. My brother and I were both introduced to prescription painkillers at similar ages. For me, wisdom teeth, something like that, just a minor surgery where they would, to alleviate the pain. And something I always wondered was, he was introduced to that at 15. I was introduced to that at 15. We had relatives that had issues with substance use. What was so different for him and I that this was something he gravitated to after that, and I just wasn't. My mom was very, very vigilant in the way that she would give us our medications. Yes. Right after a couple of days, and at the time I'm a teenager, I'm like, Mom, I'm fine. Like, you don't need to do this for me. It'd be 3 days, and we would watch her like pour the rest out. Like, okay, this is it for you guys. And I just, it was always. I just never felt. Of course, it was interesting because I can't say that I didn't like how I felt on painkillers, but I never was drawn to seeking them out afterwards, where that wasn't the case for Guy. And that's absolutely not a character flaw or a personality flaw, but that's just, it was the difference between how we, were. Yeah. And so I just always wondered why wasn't it me as well?
After Zach came to us, we, like Chris said, he went to Tennessee for treatment for 30 days. And I distinctly remember when we were leaving there, they had like family day, like a celebration, whatever. And I remember one of the counselors saying to us, we will probably be seeing you again. Most people come back 2, 3, 8 times. And I remember just looking at Chris and kind of going, we're done. Like we were so naive, and we're just, Zach is fixed. We're going to go back to our normal lives, and that's the end of it, let's move on. And, that was all through being, because we weren't educated at all on, we knew nothing.
Well, I think that Chris is really the nail on the head here, is that really there is a genetic component to this. There's also the social network component with the friends bringing this back. It's a very complicated set of disorders that we're dealing with here. And so somebody coming in like they did to you and saying, we have a simple solution, that should be the first red flag. And your son was smart enough to see that.
I know one of the barriers that we ran across when he was in treatment, I knew he was suffering from some depression. Yes. And I knew that was a contributing factor to his substance use disorder. And I was so mad because nobody was advocating for my son. I was the only one that could be his voice and advocate, and here we are today, we're all of their voices. And you need to get set up with a counselor, psychologist or psychiatrist, so that we can try to get to some of that root, deep inner stuff going on, because it is a complex issue. This isn't treating a sinus infection. Right. You don't just take an antibiotic and everything goes away. And I was so frustrated because I went with him to his second appointment. I asked him, I said, how did the first appointment go? He goes, I was in for maybe 10 or 15 minutes, Mom. He gave me 2 prescriptions and sent me out the door. I said, he did what? And so I said, well, I'm going with you to the next one. So I went with him to the next one. Same thing. Gave him a prescription, sent him out the door.
This is why one of the things that we talk about a great deal in my line of work as a medical sociologist really is about the healthcare system, because providers are not rewarded for spending time with patients now.
And this is your job.
And
You are a psychologist. You are a psychiatrist. Your job is to spend that hour trying to get to know this patient and what led them up to this. He looked at my son and said, well, why can't you stop?
Well, we expect those type of statements from family members, friends, the community, right?
Right.
But from a person this person is giving you guidance and medical counsel on how to get through this addiction, and they say it's scary.
So Jenny and I, we've actually, because when you're making these decisions to find the right care for your loved one, you're doing it at a crisis point. So it's hard to find it. Okay, so we've had meetings with Anthem. Okay, and we've tried to tell them, so you need to have a path to care for people that they can get to, because this is expensive. So trying to find treatment that's affordable, and what's in the network, what's out of the network, and so we just don't know. So if you could have a grouub of providers that you trust, they're going to help people. I mean, this deal about, well, we're only going to approve for 30 days, that's almost like a joke. I mean, because somebody might need 30 days, somebody might need 180 days. It just depends on the individual, like you had mentioned. So we tried to tell them, have like a centers of excellence for this. They do it for autism. If you're a Anthem member and you have a loved one with autism, there's a group of providers you can go to and get care. I go, you need to do the same thing for this. This is affecting so many different aspects of people's lives. And if they could just get a trusted group of providers, let them decide what the care is. If it's 30 days, 60 days, whatever,
Absolutely.
It would help us so much,
Absolutely.
because we just don't know where to turn when like this happened to Zach. We're just searching. We found a place in Nashville. Was that the best place? We didn't know. But we need help to find those right places.
Yeah. I think that, well, it's not what I'm doing, it's what people here at IU are doing in general. But I think that's why this movement toward precision health and precision medicine it includes genetics, so that one of the things that hopefully we'll see in the future is that they would have known this about both of your boys. That's part of it. But precision medicine, precision health is not just genetics. It is about these conditions, and it is about the circumstances and the ability to get care. So, that's incredible what you're doing in trying to get an Anthem to understand the complexity that people face here, because for all of your stories, the lost productivity, the lost love, the lost lives are just a tremendous toll that our society is paying for not having the kinds of services that we need. So really, I thank you for many of the things that you're doing in your own advocacy work.
Zach previously had gone to a rehab facility where he was living in California, and it was great that time. The care there was great. He liked the doctors there. He came out of there with a lot of useful tools. Then Zach had a tonsillectomy in June of 2017 at UCLA Medical Center, and I was there for 10 days. And he had to have pain medicine. Sure. He actually spent the night in the hospital, and so the pain management team came to me while Zach was in surgery, because Zach had been he was in IOP, and he had been titrating off of the Suboxone, and he was due to finish the Suboxone actually the week after his surgery. So the pain management team strongly suggested that he extend the titration for 60 days and hopefully for 90 days. So, but the IOP doctor refused to hear the pain management team suggestion from UCLA Medical Hospital. So he said his comment was that Chris and I and Zach had signed a contract stating that yes, Zach will, titrate off of the Suboxone. He will be done this week, and that's the end of it. And so, that led to him being dismissed from his sober living house where he had been thriving, and it just started a downhill spiral from there. And then he went back to the rehab facility that he was in that had been so good before, but this time it wasn't good. They were overbooked with clients, they were understaffed. It was just a very, very different situation, and Zach left there 2 days before his 30 days were up. We were trying to find a good sober living facility, and so he was staying in a hotel. Said, we were having trouble finding a good place, and so he said, I think I just want to come home. So on September the 1st, which was a Friday, he was packing and all excited and everything to come home, and he had a flight the next day out of Los Angeles to Indianapolis that left at 2, and I was talking to him all morning, and I was at the grocery, and he was telling me what food he liked and what he wanted me to make him, and we were just laughing, and he said, Mom, I can't wait to get home. And so I was getting ready to go through the car wash, and so I said, Zach, I'll call you right back. And so then I called him back, but he never answered. And so I was driving down the road, and I remember feeling like I was so happy, and then I remember all of a sudden I was just like shaking out of control, and I felt nauseous and really hot. And I remember having to pull over because I thought I was going to be sick. And then I got home, and I said, Chris, I can't get a hold of Zach. He should be leaving for the airport. And Chris said that he had tried to call him as well. So then I tracked his phone, and it said he was still at the hotel. And I called the front desk, and they said, yeah, he had asked for a late checkout, which made sense because of the time his plane was leaving. But now we're trying to clean his room, and we, unlocked the door, but the chain was on the door, and we think he's asleep because we see him sitting at the desk. So they said they'd call us back, and then I called the front desk again, and they said, well, we're still trying to, get into his room. And they said that somebody was going to call us back, and like 15 minutes later, they called Chris's phone, and it was a sheriff. And told us that he was gone, and that they found some paraphernalia, and what had happened was, because he hadn't done anything for over 30 days, that then what happens a lot of times is they try to use the amount that they had used prior to the 30 days, and so just really hard is that, you know, he was alone and he was so far away, and then we couldn't go to him because it was a holiday weekend, and you know, they wouldn't let us into whatever place they put him. And it's just really hard because we just feel like guilty. I do, because I feel like, you know, in those last couple of days, I really let him down because I should have gone there to get him instead of, normally we would have. I don't know why we didn't.
I think all of us have been in situations where we feel like if we had done something differently. My husband passed suddenly, and I look back at that so often about if I had pushed him more to go to the doctor, if I had done, you know, and what my physician said to me was, you know, he was a grown man, and your son was a wonderful emerging adult, you know, who had a moment of weakness, and there was probably nothing you could have done. So I understand the guilt, having been there myself, but I hope over time that you will realize that there probably wasn't anything you could do.
You know, he was packed and coming home. I mean, we were waiting. You know, that's what was. I mean, it's all terrible.
And he was happy.
But he was happy, and we couldn't wait for that homecoming, and we just thought, you know, we're going to figure this out together in Indianapolis, and where you're going to go, and so you always think about what you could have done. I mean, that's just you know, we tried a lot, and like I said, Jenny talked. They were like best friends. I was very close to Zach myself, but you know, they talked all the time, and so anyway, but it was just difficult because we were right there with him. You know,
He was
coming
an
out
hour
here.
from getting on the plane.
Yeah.
He was. They said he was all packed and all dressed, and then I got his phone records, and there was a call that came in right after I talked to him, and I called the number later and said, you know, this is Zach Burton's mom, and the person just hung up, you know. So what we assume happened is that it was like a drug dealer,
Right.
a friend who said, you know, oh, I'll just give this to you for free this time. It's on me, which is how they pull them in, you know, because they know sometimes they don't have money. And
From my understanding, his girlfriend came home and found him, and you know, it's cliche, but it's the phone call that you never want to get. And it's incredible what your brain does to help you in moments of panic and trauma. I remember it was very early in the morning. I couldn't tell you now what day or time it was because everything just shut off from there. But I got a call from my mom really early, and all she said was, I'm so sorry, Guy's gone. And I couldn't hear her the first time. It was like my brain was waking up. I'm like, what did you just say? And she said it again, and she's crying, and you know, you don't want to hear your mom cry. And it was like almost white noise from there. And I woke my husband up, and I'm like, the only thing I could think of was, we have to get to mom and dad's house right now. Like, I don't remember the drive there. All I remember was getting there, being with my mom and dad, and I was in shock, but at the same time, as their daughter, I'm sitting thinking to myself, I need to be there with them, for them. So aside from a couple of very isolated events that happened between finding out and leading up to his funeral that week, it's like everything turned off. I just remember not answering anyone's phone calls because I just didn't have the emotional energy to pick up the phone. But I don't remember anything from midway from getting to his place, or to my mom and dad's place, to his funeral. Everything blank slate. That's kind of how
protects us in
Uh-huh.
situations like that.
I've had to go back and I didn't know for a really long time what day he actually passed away. I just couldn't. I had no clue. Just I could not retain it. Almost, I've had to go back and look at his obituary, or when my mom would say that was, just because it was just so. I just completely shut off.
Thank you for telling us the story, because I think that's really important for those of us who aren't there with them when that happens.
Mm-hmm.
Would you like to take us back to the day that you found out about your mom?
Yeah, and I'll take you back a little further. So after graduating from college, I moved back home, and at the time my father, he was in the penitentiary, and so we start trying to get my mom that help that she needed, so methadone clinics, things of that nature, and it just didn't work. So when he got out of jail, he got involved, and it was methadone clinics back and forth for years, and nothing helped her disorder. And then after years of just not that not working, she got into a 14-day clinic, right? So after doing that several times, something clicked. So she went to the Salvation Army, and she was in a good place. She hadn't used for 3 months, then 6 months, and then a year, right? And so she was in this place where she was doing really well. And then I remember going to see her every now and again, and while she's speaking with me, she would nod off on me. And I hope she's not, right, going back to using again. So I kind of had an idea of it starting again. So I remember I was about to take a shower, about to go to work, and I get a call from my dad. I don't get a lot of calls from my dad. So whenever he calls, it's either he wants something, needs something, right, something of that nature. So I answer the phone, and he says, son, you might want to sit down for this. Okay, so immediately I said to myself, okay, she's overdosed again. That's what I said in my head. She's overdosed again. This has happened before. This is how this conversation starts. I said, okay, well, what's going on, Dad? Oh, your mom is gone. They found her. And then that's when it changed, right? So for the span of time in my childhood where I didn't have my parents in my life, I always wondered, would I care when my parents died? Because I'm not really close to them. I don't have a strong bond with them. Would I care if they died? And that let me know that you do care when they die. It's a different, you don't realize that that's your mom and she's gone,
Yeah.
So that was my day.
Thursday, February 16th, and I remember I'd gotten off work. I went to Jasmine's apartment. We cooked dinner. I ate dinner. We were just hanging out, had a good conversation, and I left her apartment to go to one of my recovery meetings that I attend. We kind of each did our own meetings to try and keep that part separate. So I went to my meeting, and the plan was after my meeting, she was going to meet me or be at my apartment. I had a key to her place. She had a key to mine. And the church that I was at for my meeting was probably a mile and a half from her apartment. And towards the end of the meeting, I had sent her a text message to see if she was at my place yet or if she had left, and I never got a response. I didn't really think anything of it. And then when the meeting was over, I was talking to a couple of people and finally got in my car to leave, and I was heading to my place, but I had called her twice and no answers. Still didn't have a response from her, and I just started to get a bad feeling. And so I was driving past her apartment complex, so I figured I'll just stop by, and I saw her car was still there. And when I got to her apartment, I used my key and unlocked it. When I went to open it, she had the chain on the door, which she had never done that once since we had been together. And it was almost like I knew. as all the lights were still on. I didn't see her or anything, but the lights were on. I could see in the apartment, calling her name, no response. And so I just kicked the door down. And when I went back in her bedroom, I found her. She was face down. And similar to you, like there are moments of that night that are so vivid. I think that image will never, I think it's permanently stuck in my head. But then parts of it, I don't really remember exactly. But her and I both being in recovery, we had Narcan at her place and at my place, just in case. And so my first thought, I grabbed the Narcan and I administered Narcan, called 911, administered CPR until the medics got there, and then as soon as they arrived, I had to call their family. I knew it was bad when I found her, just from the way she looked. And when she was in the ICU, she went to the hospital. At one point, they made it seem like there was a chance that they had a pulse or something like that. And we were sitting in the ICU or in the ER before they moved her. And one of the doctors came and essentially said there was fentanyl in her system, and with however much was in her system, I would have needed like 5 or 6 times the amount of Narcan that I had. But then also, they don't know the exact amount of time that she was there. I know she was actually on the phone with her grandfather, so there's like a 30-minute window there where we don't know. But yeah, just shock, not wanting to believe it's real. Talk about like receiving a phone call you never want to receive. I had to make that phone call. That was hard.
I can imagine. And so one of the things that we've mentioned a couple of times, but I'd like to go back to, is in the wake of this and looking back, and even now, on how other people respond to your situation. What would you tell people? Like, what did you need to hear from people, or what did you hear from people that you did not need to hear from people in terms of their lack of understanding or their unintentional stigmatizing of the situation that you faced?
I had family members, like my grandmother, who were extremely disrespectful and no empathy. Your mother, your father, pew, pew, that's what she would do as a kid, like that's what they do, pew, pew, talking about IV drug use. And it's like, the one thing I would want people to understand is that this is a chronic brain disease. This is not a matter of willpower. It's not a matter of how weak you are or how strong you are. Your brain, which is the most powerful part of your body, becomes overtaken by these powerful drugs. And your brain is so powerful, and it wants this dopamine so bad that it takes over your body. And if people understood that that's what addiction is, the stigma and the finger pointing and the inferiority labels, so much of that would end. And I think once we get a better understanding of what it does to the brain, it would really help people. And just as a family member, I needed that. Mm-hmm. My family members needed that. And now as an educator, that's what I try to let children know who have parents like mine. Like, your parent loves you more than anything in the world. Just right now, their brain is hijacked for a minute.
Yeah, they're incapable of getting past the thing that's grabbed them.
Yeah, it's not them. They're still the great, wonderful person they are. It's just right now their brain is a little stronger than their heart.
I think, unfortunately, for some people, until it affects them personally, their opinion and their attitude and what they believe about substance use disorder, that's not gonna change for them. I still You know, a lot of us, we live in a technology world and a world of social media. And I have still seen people, there's somebody that I went to high school with who knows I lost my son and knows how I lost my son, and will still make posts on Facebook, very judgmental. Oh, dummy. Go ahead and die, dummy. And when I see that, it makes me so angry. You know, it's like I just want to shake that person and say, you know, I'm so happy for you that your children are thriving right now and that they're doing well. And I pray that you never experience a moment that I experience in a day of what it's like to not have your child.
Yes.
And for you to say that and to have so much ignorance is so infuriating.
True, but I understand that many of you are engaged in actually fighting the good fight on this and have started or engaged in efforts to help the public understand. Could you tell us a little bit about that?
Sure. I mean, we so when this happened to Zach, I take a lot of credit. I think I had, you know, our faith. We wanted to do something first and foremost to honor him and to help others. So Jenny and I started the Zach 43 Foundation, and his number was 43. So we see 43 everywhere. You know, we get a lot of God winks signs from Zach all the time. So that's what keeps me going, because I know he's with me every single day. And so where the foundation goes, it's kind of up to Zach and God, and we'll see where it goes. But we want to do that again, to honor him and help others. And so it's, you know, really it's she's been doing so much with it as far as our website, and the hours and time and love that she has spent on it has just been tremendous.
One of the things that stigma does is that it silences people.
Well, and people, you know, we're all here because we have a commonality, and, you know, we're all part of this human condition, right? And I can tell you at Brandon's funeral, I cannot tell you how many people came up to me and said, I am so sorry for your son's passing, or, you know, Brandon, my fondest memory, you know, with Brandon is this, and by the way, my cousin, my uncle, my aunt, my brother had a coworker whose niece who had passed from an overdose. So, you know, it's people talking and being open to helping one another. We're all here to make a difference and to fill a purpose and to help others. And the more we talk about it, the more you realize, you know, there's a lot of people out there and they don't have people to talk to, but then when they find out that you've been touched by it, then they can kind of relax a little bit and say, oh my gosh, can I share my story?
Do you see things changing in a way that's positive? And do you think this generation coming up is more open-minded? Is it people our age, well, not your ages, but my age, who are harder to convince or to see the humanity in what's happening, whereas this younger generation are more open about it?
I know when Guy died, a couple of people asked me, and, you know, older than me had asked, are you gonna tell people what happened? And I'm like, of course we're gonna tell people what happened. Why wouldn't we? This is not gonna help anybody if we don't talk about it. And I know when I was a kid and we were dealing with, you know, Guy's mental health issues kind of arising younger, it was something you just, you know, late 90s, early 2000s, you didn't talk about it. And you know, I feel like I started to see that start to change early 2000s when I was going to college, and like people started talking about it more, like my classmates, my friends. And I have no problem now going to, you know, any of my good friends or people I meet, we talk about, you know, oh yeah, well, at my therapist appointment, like, and talking about therapy and seeking mental help and mental health help. And, you know, being on medication for our mental health is, I feel like the walls are coming down and people are being able to speak about it much more freely than, you know, when I was a teenager. As in my late 20s now, it's just so much more discussed.
I agree. I believe the more people that talk about it, the more that will impact change, I believe. And I've found, similar to what was already shared, that the more I have talked about it, the more somebody else seems to open up and share that they've been impacted by it in some way or another, whether family member, friend, coworker, something like that. And there still is that stigma piece attached to it, though. If I'm having a conversation or it comes out where I'm talking to somebody and I mentioned that my girlfriend passed away, and then I say, this is the reason why, you know, it's kind of, some people, they don't know how to react or what to think of that. And to me, it should be no different than if she passed away in a car accident. You know, the reason or how it happened doesn't change who she was or anything about her.
So I think there are many people out there who are good-hearted, who would like to say something to you when you say that. I think that they're so afraid to say the wrong thing. How would you like to see people respond when you tell them, you know, my girlfriend passed away from a drug overdose?
You know, it's tough because I've had, unfortunately, just being in recovery myself, I've had to attend a handful of funerals, and I know a lot of people that have lost this battle. And sometimes I don't know what the right thing to say is either. And sometimes it can simply just, you know, I don't know how it feels. I'm sorry, but I'm here for you if you need anything. But to me, it almost hurts more when people try to avoid it.
And that's important for people to hear, that really it's better to even say something maybe a little stupid than to just kind of, you know, all of a sudden be dumbfounded.
It was touched on earlier. I can't remember what exactly somebody shared, but when, you know, kind of similar to when somebody tells you, I don't get it, like, why don't you just stop? I've had people tell me before, because it was just a couple weeks ago, it was the 3rd year anniversary of her death, and I've had people tell me before, you need to move on. And I mean, not a day goes by I don't think about her. And for me and her family, we've said it before, we move forward, we don't move on, because that, you know what I mean? Like, that's not something you can just move on from and act like it didn't happen. It happened.
And that's such a great line, though. We move forward, right? You're not stuck, but you're not going to forget.
Yeah.
I think that's really important. You know, I heard somebody say not too long ago that, you know, you don't really die until everyone that you're in their memory has passed on. So as long as we hold them in our memory, they're still there and they still matter.
For me, the best thing that people would do was they wouldn't say anything. They would just give me a look, pat on the shoulder, and people that were more intimate with me, they would sit down next to me and not say anything. And that was more therapeutic than, I'm sorry for your loss, and you want to talk about it?
When people say, I'm sorry for your loss, I mean, that's a kind of a blanket sympathy statement, right? That's kind of what we were, you know, taught to say to someone who was dealing with grief, is I'm sorry for your loss. Because yes, we've lost them physically, but we haven't lost their spirit, you know, their memories, everything, that the love that they've given us, that love is still there. So I don't know that there is a correct way to say. I know for me, I get really tired of hearing, you're so strong. I don't see how you do it. And you still have this wonderful smile. And I just want to strangle them and say, you know, I appreciate what you're saying, but you know, sometimes I'm really tired of being strong.
Yes.
I'm exhausted. This grief journey is exhausting. And sometimes I don't want to be strong. Sometimes I want somebody just to carry me.
On the topic of grief, it's and from a parent's perspective, it's really confusing because, you know, you're mourning, if you have more than one child, then you're mourning the loss of your child. But you have, like in our situation, we have 2 other sons that are alive. So it's a hard path to navigate, you know, through, you know, I've had people say to me, well, you still have Nick and Christopher. I'm like, what's your point? Like, I'm gonna forget about them, or I can't be sad about Zach because I need to be happy for them, you know? That's just not the way it works. So you have to just learn how to put on a happy face sometimes when you don't feel like it, or, you know, get up and move. And, you know, literally there's time, you know, there's days and days where you just don't even want to get out of bed. But your other kids give you the strength to, you know, you have to move forward. Mm-hmm. You know, you don't have any other choice. And, you know, it isn't, like you said, it isn't moving on. I think people don't know what to say. And, you know, it is like, just give me a hug, or just, I have friends that'll just like send me, my sign for Zach is a blue heart. They'll send me a blue heart, you know, on text messaging, or, you know, thinking about you today. Just knowing that someone is thinking about you, knowing that like Zach's friends have called me, I had a dream about Zach last night and I want to share that with you. Like, those are the kind of things that keep you going, because I think one of the scariest things is thinking that they're going to be forgotten.
Mm-hmm.
Yeah.
And, like, you know, like bringing pictures today, you know, it's like, I've already used this picture before, and then you realize, like, I don't have any more pictures. Like, you know, we haven't had any more to take, and these are all the pictures we're ever gonna have, you know.
You know, it goes to those blanket statement, I'm sorry for your loss. Or when you put out there, time heal, with time it heal. No, it's not better after the first year. It's not better after the second year. It's not better after, you know, it's like, no, 5 years, 10 years, but yes, we're still grieving, and we still miss them, and we still love them, and we're still speaking for them. And
I think the moving forward is the, you know, Jenny and I hear the moving on, that's just not a good thing to say, because, you know, I had to, for me personally, how I move forward is Zach is just such a big part of my life still. It's different, okay? It's spiritual, and he's with me, and I've mentioned before about the signs he gives me, and, you know, we still have 3 sons, one's in heaven, you know, and so I move ahead, honoring him and knowing he is still with me in just a different way, and so I feel that closeness with him every single day, and I know that's going to continue, and really that kind of grows stronger every day, you know. And, you know, God's promise for my faith is there's heaven and I'm going to see him again. Okay, that's his promise to me. So I know that doesn't make it easier here, but knowing he's with me every day and helping me in so many ways, I thank him. You know, I know he's given me signs and helped me do things, and helping Jenny and our other 2 boys, and it's just that's so important, I think, for people, that when you lose, you know, something as precious as our loved one like that, it's just, you know, to know they're always still with us. It's not going to go away. It's going to get stronger, and it is for me. So until I see him again.
So many of you talked about the loss being partially a result of the absence of good treatment, or even knowing where to go, and not having the resources in the, you know, substance use treatment sector. How do you think we can change that? What can we do to not have families go through what you're going through?
Well, I just believe from my experience and my time in recovery, and just networking, and now actually knowing a lot of the pathways to recovery, I have a lot of friends that have gotten sober and into recovery through a lot of different places, and I've heard a lot of good things about a handful of them. And so for me, that's when people ask me, I have this person, where could I go? Do you know where there's an open bed? I usually know of a couple places because I've heard people say really good things about them. I can't just trust what I read online. I have to go off what I know. But at the same time, I got sober through one specific place, but also a couple of the other places I went before that are all good places as well. So I can't say it was that place the reason why it didn't work for me, because I know people that it worked for them there. I just think at that point in my life, I think I was still struggling to realize what it is I was dealing with and what was really going on, and really trying to accept the situation for what it was. I thought somehow I'd be able to figure it out.
Well, that's very American of you, right? That's how we think, that we have this notion that, we can figure it out, we can do it. We're not a culture that likes to ask for help. But I really like your idea of we get the best information from others with experience. Again, why things like foundations and support groups are so important. So to speak a little bit more about your notion of like regulation, how can we do that?
I don't know how we do that, but I mean, just in hearing Chris talk and just, about when you act, you're in a moment of crisis and you're trying to do everything you possibly can to save your loved one. Yes. And so you're kind of just like at a loss, and you're trying to find, where can I get my child in, or loved one, whoever that relative is. One, we know there's not enough treatment facilities out there, so that's a problem. Two, we know that there are very poor treatment facilities out there that are out there to take advantage of you and your family when you're trying to save their life, and they don't care. They just want the money in your wallet. So, I think it's important for families to reach out to organizations that are non-for-profit, like the addiction coalitions and the overdose lifelines and all of those people that are out there that are non-for-profit, because they have the goal in mind in their heart, and to do everything they can to help educate, prevent, and save. And so they're going to be able to, I think, help give you some guidance versus, yes, we look to the internet, we Google, and we get a list, and we're like, we just start calling, but are we calling the right one? But yes, there needs to be some regulation put in place to separate the good treatment facilities from the bad ones, and the ones that are out there not necessarily to help you, but
like we have to keep monitoring things. I'm not sure, although I don't want to lose my own insurance, but I'm not sure that the bottom line for insurance companies is health. I think it's profit. Yeah. So I'm a little worried about whether or not that's another function they want to take up, which is quality of care, as opposed to because the insurance companies are the ones why you're not getting talk therapy, because that's not reimbursable.
We do some work with them, and they really, and they grade providers all the time. Yeah. They give them quality scores. So they have, like Jenny said, they have the data. So they need to use it and get that group of providers that somebody can go to, and that's great data for everybody. And I know they're committed, to doing that, but they've got it. They have a ways to go.
It will most likely get approved for the detox because it can be life-threatening, the withdrawals and stuff from that. But when it's opiates or heroin, you might feel like crap, but that's not life-threatening. So it's almost now like a guaranteed no if you come in. And I know from personal experience, detox and withdrawals from opiates and heroin is not fun. And when they say it's not life-threatening, that's a bunch of BS in my opinion, because it is life-threatening to where when somebody's in that state of mind and that is the thought process, I don't want to be sick anymore, this feels all, they're going to go back out and they're going to go do something. And to me, that is
death rates.
That is life-threatening.
Opiate deaths versus an alcohol death. Those numbers are a lot higher. We're losing, I can't remember the last data. If it's over 50,
154 a day.
Yeah. Mm-hmm. A day. But yet you're going to turn them down and say this isn't life-threatening? Why don't you look at those death rates? Then tell me it's not life-threatening. That's a slap in the face.
One of the really important things I think that you can do for the families out there that are facing these same challenges is tell them what you know that you think they need to know. Are there things that you can offer as advice, or do this or don't do that, that would really help them as they, face the challenges of their loved ones dealing with substance abuse?
I would say for the person who's struggling with substance abuse, I would want them to know that you are not stupid, you're not ignorant, you're not, I let myself get like that, I'm so dumb. You're not. You just didn't know that these drugs would take over your brain this way. That's it. You're still valuable, you're still worth something. Don't lose hope on who you really are, because right now you're not really you. And what I would say to the family member who has a loved one struggling, I would say that you're not the only one that has a family member that's suffering. And the more, if you begin to share in a trustworthy way with, just use your own common sense on when to share and when not to, you'll find out that everybody around you is impacted. And we can begin to heal one another when we share.
Yeah, the power of connectedness, yeah.
Don't isolate yourself, and you need to do everything you can to seek support and have as many people around you as you can to help you navigate through this, because it's overwhelming. And like Chris has said many times today, you're reaching out in a moment of crisis, and you can't do that by yourself.
I think I would say to the families, if you suspect that something may be going on with your loved one, just educate yourself. So that you could understand like what their brain may be going through, or what like the process is, where they could go for help, what support groups they could meet. Like there's a PAL, P-A-L, Parents of Addicted Loved Ones, that really everybody that's in that meeting is going through what you're going through, maybe not as bad or maybe worse, and educate yourself maybe on what drugs may look like, or what drug paraphernalia may look like, so that you can keep your eyes open, or how your loved one could change. Do they have different friends? Do they are they spending more time in their room alone? Are they isolating themselves? Whatever. There's so many different examples of that. And then also just educate yourself on if this is your reality, then what can you do to help them? Instead of, if you suspect, then like instead of just being in crisis mode, when crisis mode gets there, then you can kind of have a path that you think you can go to.
To second a couple things that Jenny said, great words there, but I tell family members, don't get mad at your loved one, get mad at the addiction. So that's something that's not really them. This is their behaviors being caused by that. So get mad at that, find a way to help them fix that addiction. And then I would, for sure tell people that are struggling with it, listen to the people that will help you the most, okay? Because addiction will lie to you, okay? You don't listen to it, because it's going to tell you the wrong thing. But if you listen to the people that really do want to help you, try to be disciplined and do that. So those would be the two things I would say to people.
Something from a sibling perspective is I was able to realize fairly early on that the relationship that my parents had with my brother and the relationship that I had, it's a very different relationship in how you cope with someone that's struggling. And I was fortunate enough to be able to talk to people and seek help. And I think if I could share anything, especially with siblings, it's that sometimes you feel as if maybe you can't talk about it because you're in this balancing act between, I have these feelings that sometimes are not very positive, because at least for me as a teenager, having a sibling that was struggling, there were times of my life that we were also worried about Guy. So I'm never ever angry with Guy, because I know he was struggling and he needed that attention. But I was like, I don't want to bring it up to my parents, because I don't want them to feel guilt for focusing on him when he needs this so much. Mm-hmm. And I just want siblings especially to know that their feelings are valid, and it's just so healthy to talk about it with people, because it helps you navigate the very complex feelings that you are going through.
I think it's important because we have survived, right?
Yes.
So it's that survivor's remorse. And it's important to know, like, it's not your fault. Because even as a child, you can begin to think, if I would have done this, or if I wouldn't have been misbehaving, they wouldn't have been stressed out. It's not your fault. And you can get through this. You can get through this. It might be difficult, without your parent at their normal state, but you can get through it. It's a success behind it.
From my perspective, being in recovery in my family, talking about it and sharing what's going on and taking advantage of organizations and like educating yourself. I know there was definitely a period of time though where my parents were, struggling dealing with me for a while, and I don't know if it was so much of maybe the stigma with that as well, and they didn't want to talk about it because maybe people would think, well, did you raise him wrong or something along those lines. But that can carry into affect a lot of different areas of your life. If somebody's dealing with that with a loved one, that can carry over into your work or something like that. And I just feel like the more you're open and can communicate about that, the more support you can receive. So just really being open and sharing about what the situation is and what's going on, and allowing yourself to receive that support.
I want to thank you all for sharing, because I do believe that you not only help others with your advice, but you help those of us who do research, trying to find answers, trying to understand the pathways. And I think that this information can go to people who maybe can change the situation. And I appreciate also very much the work that all of you are doing in response to the situations that you've encountered. So thank you very much for coming.